Tonight, we'll talk about kind of a broad overview on stem cell treatment, which is a non-surgical, minimally invasive procedure. Oops, we don't seem to be. Now, okay, here we go. Okay, just a little brief bit about me. I've been practicing sports medicine here for 30 years in the Seattle area. Founder of Seattle Sports and Regenerative Medicine, senior partner and medical director of the Sports Medicine Clinic for 20 some odd years. Was at University of Washington and now I'm at Swedish as far as on staff. I'm consulting team physician for the Seattle Mariners. Board certified, a fellow of the American Academy, and a diplomat of the American Board of Family Medicine. So talking about stem cells, some of the conditions that we treat are, I'm going to go into a little more detail on each of these, but synovitis, osteochondral defects, osteoarthritis, meniscus tears, labrum tears, partial ACL tears, rotator cuff tears, chondromalacia, and then also tendon injuries. So first we talk about kind of where stem cells were developed to be of most significant benefit, being osteoarthritis. Osteoarthritis is basically damage to that Teflon covering of the joint, which is the articular cartilage. It's kind of like when you break a chicken drumstick off, that white glistening surface, that's the articular cartilage. Well, what happens in osteoarthritis is that starts to wear down and you start to develop cracks and fissures and craters in that cartilage. And basically osteoarthritis is considered wear and tear arthritis. It could be from overuse, it could be a genetic predisposition, could have been old injuries, could have been old surgeries. Osteochondral defects are almost like a more focal area of osteoarthritis where there's damage to that Teflon covering, but it's usually just in one spot or one area. And it's oftentimes because the blood supply to that area for whatever reason, whether it be trauma or there are other things too that can cause OCDs or what we call osteochondral defects. These oftentimes affect younger individuals. We see them a lot in adolescents before their growth plates close. And oftentimes they'll heal on their own in adolescence, but in adults, they don't. And we'll talk about the options of treatment for these. There are some surgical treatment options, which once your growth plates are closed, aren't very good options. Meniscus tears. Well, for years and years and years, we've been going in and taking out meniscus tears. Meniscus does not have a blood supply, therefore, meniscus tears will not heal on their own, with the very small exception of tears that are way out on the periphery in the outer 5 to 10% of the meniscus. Those tears are pretty rare. They're called radial tears. So meniscus doesn't have a blood supply, won't heal. We can put sutures in it all day long and it'll still never heal. So all we've done for too many years is go in and take out the meniscus, the portion that's torn. Well, that's not a great option because there's a reason that meniscus is there in your knee. And what we like to do is leave it there and get it to heal. And that's something we can do by putting a blood supply there, which is what biologics or stem cells do. Labrum is kind of like when we just talked about meniscus. The meniscus of the hip and the shoulder is basically called the labrum. However, it's shaped a little bit differently. The labrum is like a gasket in the hip and the shoulder joint that can also develop tears just like meniscus tears, can cause pain, and if left alone, can cause problems with osteoarthritis. Basically, we treat them very similar how we treat meniscus tears because once again, they also do not have an intrinsic blood supply. Partial ACL tears. The anterior cruciate ligament and the posterior cruciate ligament in the knee joint are important stabilizers in the joint. Now, when those ligaments tear completely, stem cells are not going to bridge the gap. And I see a lot of people who come to me because they have an ACL tear and they want me to do stem cells. And I say, there's no way that we're going to be able to reconstruct that ligament with stem cells. So when there are complete tears, that is definitely a case for surgery to reconstruct the ligament. However, partial tears, we are able to treat extremely well with biologics stem cells. We get those to heal completely by augmenting the ligamentous structure. Rotator cuff tears. Once again, if somebody has an acute, complete rotator cuff tear where they can't lift their arm up and it just happened, they had a bad fall or they strained their shoulder tremendously, felt a pop or a tearing sensation. In those cases, you do need to go to surgery because once again, the stem cells are not going to bridge the gap on those. However, partial rotator cuff tears or even complete rotator cuff tears that have not retracted and pulled off the bone or that don't involve the entire width of the tendon do extremely well with non-surgical measures such as stem cells. The problem with where these tendons tend to tear, that there's a really poor blood supply. It's called the critical zone or the avascular zone. So if you go in surgically and put a bunch of sutures there, you compromise the blood supply even more. And 60 to 90% of all those procedures fail within 5 years. However, with stem cells, once again, we're putting the blood supply there and we're putting cells there that can regenerate and lay down new muscle and tendon tissue and heal that tear. Chondromalacia, most often we see this behind the kneecap, and it has to do with softening, degeneration of that articular cartilage, once again, that Teflon covering, but not where it is involving bone yet. But it can be very painful. We see it oftentimes in runners and jumpers, and people get a lot of grinding in their knee, which is painful. And once again, treated extremely successfully with stem cells. Tendon injuries. I treat a lot of Achilles tendon, whether they be chronic Achilles tendonitis, interstitial tears, in other words, tears within the substance of the tendon, but the tendon is still intact. We also treat patellar tendon, quadriceps tendon injuries, elbow tendon, all sorts of tendon injuries we treat. Sometimes, if it's just bad tendonitis or tendinosis, we'll treat it just with platelets or what we call platelet-rich plasma. However, if there's actual damage and tearing to the tendon, I like to use bone marrow and platelets. And we're going to talk a little bit more about that. Synovitis. So all synovitis means is inflammation within a joint. Most commonly, this is what I see in women runners. They come to me because they want me to do stem cells on their knee because they've been seeing physical therapists, surgeons, their primary care physician, and they've done everything. They have a normal MRI. They have done cortisone injections. They've done therapy, gait analysis, but they still hurt. And the way I treat these is just with what we call platelet-rich plasma, and they all do great. Don't need to do stem cells when somebody just has inflammation in the joint. The only time when we use the stem cells is when we're trying to regenerate some tissue. All right, so what is regenerative medicine? The field of study that utilizes stem cells to heal and regenerate damaged tissue. The use of autologous, meaning from your own body, adult mesenchymal stem cells. So there's a lot of different types of stem cells and there's a lot of different tissues that can arise from those stem cells. We don't want 206 different types of tissues. We just want cells that can grow up to be muscle, tendon, cartilage, and bone. And those are mesenchymal stem cells. And by virtue of a very complex software program that runs our centrifuges that was developed by a gentleman who ran the molecular biology department at Stanford, we're able to isolate just those cells out in huge numbers, in billions. And those are the cells that we then use in our procedure. little more about stem cell. It's this undifferentiated or unspecialized cell that has the ability to renew themselves and transform into different cell types within the body. All right, so this is just a short, I think it's about 3-minute video that is a very simplistic kind of a overview of what are stem cells.
What is stem cell therapy? Stem cell therapy is an injection treatment designed to heal injuries and reduce pain. It is used for arthritis and injuries to ligaments, tendons, muscles, cartilage, and bone. First, let's look at the difference between human embryonic stem cells and adult stem cells. The embryonic stem cells are pluripotent, meaning that they can become of any of the more than 200 known differentiated cell types of the human body. On the other hand, adult stem cells are multipotent, meaning that they can develop into more than one cell type, but are more limited and controlled, and thus safer than pluripotent cells. We perform the adult stem cell treatment. What is the role of these stem cells? To understand this better, let's look at this example. Your house is exposed to different elements, such as wind, fire, rain, sun, and time. All cause damage to the structure. To keep your house in order and repair any damage, you need different professionals like firefighters, construction workers, insurance agents, and a contractor to supervise and direct the project. This is no different than your personal life. You need a dentist, lawyer, financial advisor, doctors, insurance agent, and a barber, along with other professionals. So, both your house and your life require different professionals and specialists to keep them working well. And your body needs stem cells. Now, let's dive deeper and see what happens to your joints. In a normal healthy joint, you have plenty of stem cells. These cells are not only capable of doing maintenance and repairs, they also know when and where these repairs are needed. The stem cells work as a contractor that, in addition to giving instruction for repairs and maintenance, can transform into specialized cells to do whatever is needed to fix any problem. When you have enough of these stem cells, there's a balance between damage and repair, and you have no pain and no injuries. Think about when you were 18 years old. You were able to run, jump, and do the same the next day without pain. The only problem is that with time, the number of these stem cells goes down, or sometimes the severity of the injury or damage is more than the ability of your body to repair it. This leads to an imbalance and ultimately leads to arthritis, injuries, and pain. In essence, as you age, you have a lower number of contractors and workers available to do the job, or sometimes the amount of damage is too much for the available stem cells. But fortunately, there are areas of your body that keep a good number of stem cells. These areas include the bone marrow of the hips and the fat in your abdomen and buttocks. And this is the key to stem cell therapy. The doctor will take stem cells from one or both of these areas and transfer them to the area of injury or arthritis. This will provide the stem cells needed for repair. In essence, the treatment will supply the manpower needed to do the job. Once there, these cells secrete growth factors that will organize and coordinate other cells to do the repairs. This leads to healing. This is like the contractor giving instructions to get the job done. This treatment can be used for pain with injuries coming from ligaments, tendons, muscles, bones, cartilage, and meniscus. When is it useful? If you have an injury or an arthritic condition that did not improve with therapy, medication, other injections, or surgery, or if you were told you need surgery, then stem cells is a great option for you. Thanks for watching.
Wait. exit this now to get to. So at the end, I was just going to let everybody know if you guys have questions, you can send them in on your emails, and Jensen will be able to send them over to me on my screen, and we can go through and answer those. And all right, so when we all were 10 years old, we had basically per cc, you had like 2 million stem cells floating around. And then when you hit age 60, you've got about 2,000 to 200,000, depending upon size and age. So what happens is you get less and less stem cells as you age. However, the stem cells, if we were to compare one stem cell, a 75, 80-year-old to one stem cell of, a middle linebacker on the Seattle Seahawks, there's really no difference between cell to cell. It's just that bigger people, younger people have more stem cells, but we're talking even, we've done hundreds of patients in their mid-90s who do just great. What we do is we take the stem cells, as that video had mentioned, from the posterior iliac crest. So basically you have your spine comes down in the middle, and then you've got the pelvis on both sides. That's where I go get the stem cells from, and then basically the love handle area, because the stem cells that we get from bone marrow are very robust and long-lived. The ones we get from fat are prolific. We get tons of them. Plus the matrix, the collagen of the fat, is a great matrix for those stem cells to adhere to the bony or the ligamentous surfaces. Now, stem cells and platelets have not only regenerative capacity, but they have anti-inflammatory capacity. So what they do is they decrease inflammation, but then after that, they start to regenerate tissue. So what I get a lot, people come in and they say, hey, I don't want to have a total joint replacement, or I'm thinking about having a total knee replacement and I'm not thrilled about it. I know my neighbor down the street it's been a year, he's still in pain, he's still having issues. So the big data on total knee replacement, basically 65 to 70% of patients who have total knee replacements are happy with the results. But that means 30 to 35% are not so happy. And you can end up with more pain afterwards. And then it's an end game. There's really nothing else you can do. I probably see 2 or 3 patients a month who come to see me because they had a failed total joint replacement a year or 2 or 5 ago, and they want me to do stem cells. I said, well, it's too late, because all you got now is metal and plastic in that joint. So some of the complications of total knee replacement, infection is a big one, blood clots or DVT, which can then flip off and go to your lungs. Men and women over the age of 60 have 30 times and 25 times greater incidence of heart attack and stroke in the 1 year following a total knee replacement. And that's because it's a big surgery. We're amputating your joint. There's a lot of bleeding. Subsequently, there's a lot of clotting. Sometimes some of those clots break off and make their way other places in your body. Total joints do not last forever, and they tend to loosen, and then they have to be redone, and revisions never turn out as well as the first procedure. As far as dementia goes, there's talk about dementia. There are studies being done, and basically the thought is chromium, cobalt, nickel, and titanium are heavy metals that can leach into your blood system and potentially cause damage to neural structures. So when we do a procedure for biologics or stem cells, it's a fairly easy preoperative list or procedure. We have patients avoid taking non-steroidal anti-inflammatories. That includes things like CBD, turmeric, ibuprofen, Advil, Aleve, for 5 to 7 days prior to the procedure. We want patients to drink lots of water, at least 64 ounces for 2 days before the procedure. And we avoid medications that may interfere with bleeding. In other words, if somebody is on a blood thinner, whether it be for atrial fibrillation, or they had a blood clot in their calf or in their lungs at some point in the past, or if they have a mechanical or they have a valve in their heart, then oftentimes we need to either go off the medication for a couple days, which is usually not an issue at all, or sometimes we do what's called a Lovenox bridge to get patients through the procedure. But it's something that we just need to be aware of. It's certainly not something that is a contraindication to doing the procedure. And if somebody has an acute infection, so somebody has a sinus infection, pneumonia, skin infection, we don't do the procedure if there's an infection, and we put that off and treat the infection with antibiotics. So what do? The gold standard is using platelets, and platelets are these great little packages of growth factors, cytokines, exosomes, and ultimately anti-inflammatories, bone marrow, and adipose. Okay, so platelets that we get from blood. We draw blood, goes through the centrifuge, layers out to something called the Buffy coat, which we then pipette off, and we save the platelets. The bone marrow extraction, this is what everybody's always concerned about. So literally half the patients that we've done, and we've done thousands and thousands, they turn around and they say, "Are you kidding? You're done already?" And half of them are like, "Oh, boy, that really hurts. That feels like sciatic nerve pain going down my leg, or it feels like a deep hollow ache." However, I have done so many bone marrows that it takes me less than a minute to do the bone marrow extraction. So if there is pain, it literally lasts about 30 to 60 seconds. Then what we do is a mini liposuction, kind of in the love handle area. You usually don't even feel that at all. And that takes anywhere from kind of 1 to 3 minutes. Those cells are all then prepared, and they go through separate programs on a computerized centrifuge so that we extract, concentrate all those stem cells. And then utilizing ultrasound. I don't like to use X-ray in the office. Some people do use what's called the C-arm, but then everybody's got to be lead aprons and gowns and such. But we use ultrasound, which I prefer, and that guides our injections. The injection itself, basically a couple minutes, if that. Patients walk out. It's local anesthetic. Listen to music. We do give you pain medication ahead of time. We use local anesthesia as far as ropivacaine or lidocaine. And the only thing is you do need a ride from the office. Most people go back to work the next day. They start physical therapy 3 to 5 days later. I think we talked about all this earlier, as far as contraindications, yeah. Okay, yeah, this is another thing. There are a lot of bad actors out there that are utilizing desiccated amniotic fluid, embryonic cells that, I mean, you can buy it online, and this is what some people do. They buy the stem cells online. Most of the time, they come from women who are willing to sell their placentas, and most of them come from south of the border. We do know that there are 0 live stem cells in those products, and God only knows what else. So be very cautious. The only way you want to do this, basically it's going to come down very, very soon. It was supposed to come down about 2 years ago, but then COVID happened, that these products are going to be taken off of the market by the FDA. Okay, results. So when people come in and they're mild, so we grade arthritis as mild, moderate, severe. Patients who are mild to moderately severe, big data says 85% of patients obtain at least 80% improvement. In my patient population, and like I said, we've done thousands and thousands of them. Overall, and this is across the boards, from patients who have mild arthritis all the way to severe, 91% of our patients are at least 75% improved in when we survey them with what we call PROs, or patient-reported outcomes. Now, the other thing is that, and I've got some questions that have come through already, but people are talking about, well, I was told I'm bone on bone. I would say at least 95% of the time that a patient comes into me and says they were told that they're bone on bone, and they bring their films, whether it be x-rays or MRIs, and we sit down and we look at them, they're not bone on bone. It's a term that gets thrown out there very, very loosely. Truly, when I do have patients where they're bone on bone and there's no joint space, their percentages are not as good as these that I'm talking about here. And oftentimes, if I don't think they're a good candidate for biologics, I'm going to send them to, one of my surgeon friends, or at least give them the option. There are people who come to me and say, you know what, doc, there's no way in hell I'm having a total knee replacement, or a total shoulder replacement, or a total hip replacement. I want to do stem cells. I don't care if there's a 25% chance I'm going to get better. So as long as people understand that, I don't have a problem doing it, because I do get a lot of referrals from surgeons because either somebody doesn't want to do a joint replacement, or maybe because of other comorbid conditions, and maybe they have heart disease, or they had a stroke, or they have diabetes or obesity, make them a very poor candidate for a big surgery. So they'll send them to me to talk about stem cells. So I'm just going to go through a few scientific journals and clinical studies here. I'll put my glasses on so I can read them, but I'll just go through these. These are basically summaries. First one's out of the Journal of Bone and Joint Surgery. There was evidence of meniscus regeneration and improvement in knee pain following treatment with human mesenchymal stem cells. These results support the study of human mesenchymal stem cells for the apparent knee tissue regeneration and protective effects. From the Journal of Clinical Orthopedics and Trauma, the versatility of stem cells as a treatment modality has landed it another repair target, osteoarthritis. Through many studies, this newly discovered method has been shown to significantly alleviate the pain experienced by osteoarthritic patients. From Helion, this study showed that a single intra-articular injection of bone marrow stem cells appears to provide long-term benefits. The procedure is simple, fast, well-tolerated, avoids the need for hospitalization, and generated no complications or adverse effects. From Journal of Orthopedic Translation, in contrast to traditional treatments based on drugs, proteins, antibodies, stem cells are poised to revolutionize medicine as they possess the capacity to replace and repair tissues and organs such as osteoarthritic joints. From Nature, the British Scientific Journal, in conclusion, mesenchymal stem cell treatment improves knee pain, physical function, and cartilage quality without an adverse event or severe adverse events. And the next one is on cartilage mapping, which I do have a couple of pictures here, showed significant improvement in cartilage scores. Basically, so for osteochondral defects, which we had talked about way back at the beginning here, these are like these craters or holes within the bone. Well, a lot of times the surgeons like to do what's called microfracture surgery. They drill a bunch of holes and hope that you get bleeding into that area, and that there may be some cells like osteoblasts or chondroblasts to lay down some new scar cartilage. In my experience, it does not work very well at all. And so basically, this is just a study showing that the difference between microfracture surgery results as opposed to bone marrow results. And at 12 months, the results were significantly better for the bone marrow rather than doing any microfracture surgery. Most of the time, I see patients get worse when they have microfracture. The biggest study that has just come out, and I'm just trying to figure out, Vincent, how do I move this bar so I can see the rest of this? Okay, so this actually, two guys out of Harvard just did a comprehensive review of 34, it's either 34 or 43 major studies and journal articles, and they published this review in the NIH journal, National Institute of Health. This study demonstrates that autologous mesenchymal stem cell injections provides consistent, clinically important improvement in osteoarthritis disease parameters, and that both the magnitude and the duration of improvement far exceed any improvement that may be seen from a placebo effect. Furthermore, the duration of efficacy out to 2 years, they just did this over a 2-year period of time, from a single treatment greatly exceeds that of any other non-surgical treatment or any possible placebo effect, particularly in light of its excellent safety profile in the absence of other safe, effective treatments. AMSCI, which is basically stem cell treatment, should be widely adopted for the treatment of osteoarthritis. So lots of cases done in the US. They're doing it, at all the major centers across the country. Worst case scenario with stem cells, you fall into that 9 to 15% bucket, and it doesn't get significantly better. That's the worst case scenario. There's no general anesthesia needed. Patients are usually back, usually by 2 weeks, they're doing fairly significant activities. When it comes to ankles, knees, and hips, you're on a bike in 2 weeks and then an elliptical. And then most people are back to significant activity by 6 weeks, and by 12 weeks back to just about anything that feels okay. After the procedure, just kind of take it easy for a couple of days. Ice it. You can take Tylenol. We don't do any anti-inflammatories. And we start physical therapy. And therapy we do close to home. We find somebody good that's convenient for you, usually twice a week for 3 to 6 weeks. And then I think we're going to open it up. I already have about 3 pages of questions here that I'll start going through. And if anybody out there wants to send through their questions, I'm happy to just start going through all those right now and kind of open that up. So let me go over some of these that I've got here. First question was, can it be done for hands? Yes. And I'm a prime example of that. I have arthritis at the base of my thumbs. 8 years ago, I had stem cells on both of them. It's been a game changer. It works extremely well for the base of the thumb joints, which is called the first CMC joint, and for the wrist. And then when we're getting the smaller joints like knuckles and the fingers, I usually just do platelets or PRP. Only downside to stem cells, not covered by insurance. The physical therapy is, the follow-ups are. Usually, if you have like a HSA or an FSA, you can use those funds, but insurance policies do not yet cover stem cells. Somebody else talked about bone on bone. Once again, if you have a question about that, I have people come in with their images, or we do images at the office, and oftentimes they're not truly bone on bone. Hip joints work extremely well. This is somebody I'm just kind of going through. How to avoid meniscus tears. That's a tough one. Basically, don't get in or out of a car or on and off the toilet seat. I mean, that's oftentimes the meniscus tears aren't, being blindsided by Bobby Wagner on the football field. They're simple things. They're bending down, they're squatting over, they're getting in and out of the car, and it's just the meniscus gets caught between the femur and the tibia, and things tear. Or you have arthritis in the joint, and that can cause the meniscus to start to degenerate. I've had 7 knee surgeries for meniscus tears, now bone on bone. Want to see is, once again, make an appointment for a consult, and we'll take a look and see. If I don't think you're a good candidate, I will tell you that for sure. Meniscus tears, like I said, works extremely well in meniscus tears. How to select a provider. The main thing you want to do is you want to have a board certified physician who's done, a lot of them, and, who'll be very candid with you if he feels that you're, truly a candidate versus, whether or not you need any type of surgical consultation. Can stem cells help radiation damage? If the radiation damage is damage that has affected either the cartilage or the meniscus or ligaments, then yes, as far as the joint itself. As far as other types of radiation damage, like to soft tissues, probably not. And then, as somebody said, for our religious patients, please be specific about the origins of the base material. This is stem cells come only from you. We just take them from your bone marrow, your fat, and platelets from your blood. So I'm not using any what we call allografts from elsewhere. So it's not an issue as far as, you know, ethical or religious concerns. Torn meniscus, osteoarthritis. So somebody said, can it help meniscus that removal that was done years ago? Oftentimes, when you take somebody who's had a meniscectomy, or surgery, they had a scope and the meniscus was partially removed, 85% of those patients are going to end up with osteoarthritis. So it's usually the arthritis, or it could be a recurrent tear in the meniscus, both of which could be significantly helped by stem cells. Somebody learning about studies. So is stem cell treatment FDA approved? Stem cell treatment is FDA approved right now if you use stem cells intraoperatively. In other words, we're doing open surgery, we're in the OR, and we're repairing a torn rotator cuff, and then we put stem cells on top to improve the healing. However, for percutaneous use, like we're doing in the office, it is considered FDA cleared and FDA investigational. Although, if you look at places like Mayo Clinic, Cleveland Clinic, Hopkins, Harvard, Stanford, the two largest orthopedic centers in the country, Curlin, Jobe, and Stedman, everybody is doing stem cells and seeing, you know, wonderful results with it. Spinal stenosis. Somebody wants to know, does it work for spinal stenosis? I don't do spine, but I do know providers who do spine. Nobody really up here doing a great job with spine. The people I know are in Portland and down in Las Vegas. But for certain things in the spine, it can be a good option. Let's see. Somebody wanted to know about rotator cuff tears, which we talked about. Works great for tears that are not acute. In other words, if somebody had a tear like 6 months or a year ago, and it was a tear where it's a complete tear, and the rotator cuff is pulled off the bone and it's atrophied and come away, surgery is not even going to bring those back. So in those cases, yes, it does make a difference with shoulder pain, range of motion, and strength, but it is not going to bring that tendon back and attach it to the bone. But at that point, there's nothing really that is going to do that. Partial tears and full thickness, but not full width tears work wonderfully with stem cells, as do labrum and osteoarthritis in the shoulder joint itself. Now I'm going to look at some of these. I'll go through some of these questions that are coming through now. Go up to the top. For disc, somebody said is for disc. Yes. Once again, you want to try everything conservatively as far as, physical therapy with a manual spine therapist, possibly epidural steroid injections or facet injections, which we would look at those based on the results of MRIs and bone scans. So once you've tried all other conservative measures, then, biologics might be an option. Recovery. What is the recovery time for a shoulder? Basically, you're back to doing all your activities of daily living, the next day. You're not hanging from monkey bars. You're not doing American Ninja Warrior. You're not doing bench press or military or push-ups. But that comes more like out at about the 6-week mark. So by 6 weeks, most people are back to, playing golf, although they're taking it easy off the tee box, maybe taking an extra stroke. And back to significant strengthening. And then by 12 weeks, whatever feels okay. And a lot of that depends upon how bad the issue is. Is it horrible arthritis in the shoulder? And it's, you got to look at the options. A lot of times people come in and, the only option they have is a total shoulder replacement. Yeah, it's not a great option if you want to be active, and they do not last very long either. Let's see. Somebody says, are there good randomized control shows? So the outcomes, those are the ones that we went over in the talk here. The biggest one being the one that came out in the National Institute of Health. Can I do 2 areas at one time? Absolutely. We can do, the most that we can do at one time are 3 large joints. So wrists and a shoulder, there was the question here. Yes, oftentimes we do them. Nice thing is that when we do more than one joint at once, we're able to use a double kit or a triple kit instead of single, and it saves patients a lot of money. So what are prospects of stem cell therapy for severe osteoarthritis of the hip? Also, how painful is the procedure? Severe osteoarthritis of the hip, all depends. It depends how bad the hip joint is. If it's pure bone on bone and the range of motion is gone and you have severe pain, sometimes I'll be very honest with patients. I'm going to say, you might only have a, 40-50% chance of getting better with stem cells. But yeah, that's something that oftentimes we just have to look at images and see. As far as how painful the procedure is, like I said, the bone marrow, very quick. Some people have no pain. Some people do have discomfort with it. Injection in the hip oftentimes feels like a balloon getting ready to blow up because we're putting a lot of basically product. I say product, but it's stem cells fluid into the joint itself. But, and it can be sore, achy for a couple days, but that definitely eases up. Why is it not covered by Medicare and most insurances? There's a lot of, the FDA takes a long time to approve certain procedures. Like the procedure that we do now for hip replacement is an anterior approach. It took like 17 years to get that approved, and now it's the standard. So things take a long time to get through the FDA and to get approved by insurances. What everybody always asks me, patients come back and they're like, oh my God, I had a total joint on the left and I still have issues, and you did stem cells 6 months ago on my right, and it's just a miracle. Why is insurance not covering this? It makes no sense at all. Actuarially, it makes no sense at all because the cost savings are huge. Can the platelet-rich plasma come from yourself? Yes, that is all we do. It only comes from you. We're not going to get it from anywhere else. What about poor circulation in your knee? Shouldn't affect anything because we're basically putting blood supply in the joint itself. What are the complications of stem cell therapy? How often does it happen in your experience? So basically, it's the same potential risk as any time you put a needle in a joint, whether it's to take fluid off, to inject cortisone, or to do stem cells. So there's always a risk of infection. Although, knock on wood, I have literally injected hundreds of thousands of joints and have never had an infection in my practice. Do you see similar results in older athletes with osteoarthritis who want to get back to high-level sports? Absolutely. I just had a guy call me from the North Shore of Oahu. He surfs Sunset Beach every single morning, 79 years old, but he's just miserable because of, I can't remember if it was his shoulders or his knees. And he skied 100 days this year at Sun Valley, and he wants to get back and be able to maintain that level of activity and fitness. And I see absolutely no reason, why he can't. What if I've had a partial knee replacement? If there's arthritis in the other side, then yes, it can work very well. I've got actually a ferry boat captain just recently that we treated that way, and he's doing great. So average cost, it's usually somewhere between $5,000 and $10,000, depending upon the joint or joints, whether it's a single or multiple joints. Let's see. How long will stem cell treatment last on the knee? Oh, okay. So here's good. It all depends on 4 things: your weight, genetics, how far you are along in the course of the disease, and your activity level. So basically, one of my first patients I ever did about 7 or 8 years ago was an ultra marathoner, and his bucket list goal was to finish the Western States 100, which is a race across the Sierras, in less than 24 hours, and you get this big, gigantic belt buckle. Well, his knees, he had horrible arthritis in his knees. We did both of his knees. He was able to train for 2 years. He finished the race in under 24 hours. He came back to see me a year later. He said, "Doc," he goes, "will you please do my knees again? I'll sign a contract. I promise you I'll never run again." And so we did his knees again. He's cycling. He's doing fine now. He's not running anymore. So it all depends, kind of where you are and what you want to do. My surgeon shaved most of the cartilage off my shoulder. Can this treatment replace that? Very good possibility, yes, that it could. It sounds like most likely that was the labrum that was treated with surgery. Muscle tears, yes. The only difference in muscle tears is that I treat muscle tears with just bone marrow and platelets. I don't do fat in muscle tears. If they're not complete tears where the muscle, like a biceps tendon that tears completely, you end up with a biceps that looks like Popeye, those, they're not going to come back. Yeah, otherwise muscle tears do very well, like glutes, hamstrings, elbows, tennis elbow, golfer's elbow. This is a comment. I had stem cell therapy by Dr. Wagner on both my torn rotator cuffs and biceps, and it is amazing. I would do it again. Well, thank you, Nikki. What else do we got here? Are the stem cells removed just prior to injecting the cells into the damaged area during? Yeah, everything is done within basically an hour period of time. We don't want those stem cells. They don't leave the room. They stay with you in the room, and we don't like to keep them out of the body for more than about 15, 20 minutes. Although you can keep them out of the body for up to 8 hours, according to the FDA, but we don't like to do that. If I have loose bodies in the knee, do they need to be cleaned? It all depends. If the loose bodies are catching and causing the knee to lock, then yes. Otherwise, if they're not, then not an issue. Is PT standard for the body part you have, or is it something special? It usually varies depending upon the joint that we're treating. How long do the benefits last? So Bornstein at Harvard's been doing this for 18 years. Got patients out 18 years doing just fine. And let's see. When is the best time to do it? Before rib problems occur or when osteoarthritis, no pain? So the thing is, the earlier you catch the issue, the better people do. So your percentages, when patients come and they're early on, they have mild osteoarthritis, small tear in the meniscus, small partial tear in the rotator cuff. We like to jump on them early because people do extremely well when you're early in the course. We don't want things to get really bad, and then oftentimes your percentages tend to drop off. Okay, I think. Oh, here we go. Another one. Can stem cells help with Dupuytren's contracture? No. They may help with some of the pain associated with it, but they're not going to relieve the contracture. Oftentimes you just have to go release those tendons, and you got to go talk to one of the hand surgeons. Well, I think that is all of the questions that I see here. So yeah, if anybody has questions or people are interested in consultations, all you have to do is look me up at Seattle Sports and Regenerative Medicine.